Hello, everyone. Today we're going to talk about thyroid and brain fog and how you can reclaim your energy. So, I would consider thyroid issues a healthcare crisis. A lot of times, things like fatigue or brain fog are very common. Thyroid issues are many times they're misdiagnosed or underdiagnosed, or the medical professional may not seem all that concerned about the thyroid health and they're not running enough tests. Some people are on medications and they're not working, or they're on the wrong medications and it's overstimulating the thyroid, and there's all kinds of things that happen that maybe aren't necessarily clinical, but they are actually problems when you get to looking, like we'll talk about today, how important the thyroid is to your health. Sometimes we'll see patients that have medications that are constantly changing because the thyroid is dependent on many other organs and functions in the body. And so if that particular organ or function changes, then that can change how the thyroid functions as well. But not always is the medication changed to go along with that. And a lot of times the solutions, like in most things that we see in our office, the symptoms are being addressed, but the actual underlying cause is not. Thyroid disease is very common. About 20 million Americans suffer from thyroid disease. 60% of people have thyroid disease but are unaware of their condition. And the reason for that is because the labs for thyroid can be run, and sometimes the labs will come back normal, at least what we call lab normal, but that doesn't mean that the thyroid is necessarily functioning correctly. So really, when a lab test is being ran from a Western medical perspective, they're really only looking for pathology or really serious medical conditions. Most of the thyroid issues that we see are what are called subclinical, which means that they won't necessarily have a symptom or an outright problem that's obvious, but the reason that we see all these issues where 60% of people have thyroid problems is because it's not being caught by the medical professional. So this is what I mean by the labs can be normal, but you're still feeling like there's something wrong. And so if you look at this diagram here, you can see there's this on the bar here, the red area, that's what's outside of the normal lab range. And so then inside of the lab range, there's this thing called the inaccurate lab range. So that's when things are not normal, but it actually doesn't show up on the lab test. And then where we function most of the time is in what we call the functional lab ranges, or the optimal ranges, which you'll see on some of the reports that we do when we run our functional lab tests. So you could be telling your doctor you're sick, but on the lab work, the doctor would not know necessarily why you're sick because they're only looking at those standard ranges that are designed to cover a broad base of patients and not an individual's specific problems. So in those cases where you're feeling sick and your doctor's telling you, well, there's nothing wrong with you, or I don't know what's wrong with you, everything's coming back normal, that's where you're going to have help getting what you need in terms of feeling better, getting rid of the brain fog or the fatigue or some of the other symptoms that we see with thyroid. And that's why we always choose to test and not guess. And you'll hear us say that a lot in the office when it comes to functional medicine, is that we're driving most of our decisions based on laboratory testing and not just on hearsay. So for a complete thyroid panel, most of the time, a standard panel that'll be ran just as a screening test in a Western medical office would be free T4, free T3, and TSH. But since there's so many things that can affect how the thyroid functions, there's a whole host of other tests that normally don't get ran unless you see an integrative medicine practitioner or a functional medicine practitioner. So that we're going to add to that reverse T3. We're going to look at the thyroid antibodies to see if there's an autoimmune disease that could be causing the thyroid to malfunction. We also need to look at iron and ferritin, something called total iron binding capacity and percent saturation. We also want to look at hormones. So we'll look at salivary cortisol, which is the most accurate way to test the adrenal hormones. as well as B12 and D3, magnesium, potassium, and sodium. And this would be what we consider a complete thyroid screening. So there's a condition called hypothyroidism, and that's where there's a need to turn on the thyroid. There are synthetic versions of medications. You might have heard of Synthroid or levothyroxine. There's also glandulars like Armourthroid and Natrethroid. So there's different ways to turn on the thyroid. The challenge here is that usually it's a large dose of T4, which is the unconverted form of thyroid, and that's usually the last thing the thyroid needs is more thyroid that it's not converting because the thyroid typically is not converting to begin with. So a lot of times the medical management might result in the patient not feeling like they're getting any better because it's actually the wrong treatment. In more rare cases, we have hyperthyroid, where the thyroid is overactive. You might have heard of Graves' disease, or some sort of condition where the thyroid is overproducing T4. So the medical management here is going to be some sort of radioactive treatment, radiation treatment with radioactive iodine, or surgical removal in some cases. We've seen patients come in with that. But the problem is this causes permanent damage to the thyroid. Removing the thyroid, of course, leaves you with the inability to manufacture thyroid hormones. And so that destruction of the gland isn't necessarily always the best approach, but it is easier to manage a hypothyroid condition than it is to manage a hyperthyroid condition. So in a traditional medical approach, or what we'll call a Western medical approach, this philosophy is based on the treatment of symptoms, meaning you have a problem and then you're given some sort of drug or injection or surgery to address the symptom, which is usually already happened after something has been going wrong for some time. So then the approach is to look at what condition you have and then what drugs do you need to address that condition. So this is how we are educated. This is why 60% of the commercials on TV educate you to think that you need a drug for a certain problem or for a certain issue that you're suffering with. And so the public by and large is educated to this sort of philosophy. And so for this type of philosophy then, because drug companies are a business, they are for profit, then thyroid medications, diabetes medications, to them that means that you need to have prescription drugs for life, and that makes you a great customer for them. In functional medicine, we look at what the underlying cause of a problem could be. There's four main things that influence your health that we'll always want to consider first, at least from a historical or a health history perspective, and that's going to be physical traumas, car accidents, slips, trips, and falls, things like that, stuff that's physically happened to your body. We also look at emotional stressors, job stress, getting on social media too much, or having trouble at home with your spouse or your loved one. It could be a lot of things can fall into the emotional realm, especially these days. We also have to consider chemically what you're doing to yourself. That could be drugs that you're taking. It could be food that you're eating. It could be environmental exposures that you've had. Maybe you've been in the military, or perhaps you work in a job where there's a lot of industrial exposure. And so chemicals can really affect the body, really very severely in some cases. And we also have to look at your immune system and how healthy is your body, how run down is it, and what is your body able to or not able to do because of a properly functioning or a malfunctioning immune system. So what if there really was a better way to address thyroid issues? What if we could discover the cause of thyroid problems and not just treat the symptoms? What if we could run those lab tests and reveal if the thyroid truly is the problem? And what if we could find out if there was other health problems that could be contributing to your thyroid problems, and then balance your hormones without drugs or surgical removal? And that's the good news. We figured out a simpler way to recover thyroid immunity and also brain health. So we have a special approach here at Vitality Integrative Wellness. And when it comes to health, you can take a reactive approach, which means that you would wait until a problem shows up and then you decide to seek medical advice or medical intervention. In a proactive approach, it's a preventative approach. And so in that type of situation, what's happening is we're doing screenings, we're doing evaluations, we're regularly checking things to make sure that when it does show up in that subclinical category, that we're getting out in front of it. And by and large, you won't even be feeling anything or know that anything's wrong. We'll just happen to discover that on some sort of test or examination. But this allows you to be empowered to take control of your health. It also allows you or teaches you to learn to listen to your body. And that's why we want to find the root cause of the problem, because when we do that and we're constantly in that mode, then you no longer have to treat symptoms. So one of the best ways to get our message across is to talk about patients or patients that have given us testimonials. And so this is Nancy, and when she came to us, she was constantly tired, she was in pain, full of anxiety, had some weight issues, and so had tried all the diets, keto, paleo, starvation, fasting, spent thousands on supplements, and still with lab testing, with multiple visits to her primary doctor, they had no idea what was wrong with her and really couldn't give her any answers. So she was at rock bottom. She was having trouble focusing at work. She was reliant on sugar-laced coffee drinks. She had a crash every day at 2 p.m. And her doctor kept telling her that her labs were normal, just like we talked about in the beginning. That's a very common thing. But patients are smart. You all are smart, and you know that even though you're being told that something is normal, you can feel inside that something's not normal, and that's really what was bothering Nancy. So the difference in our approach with Nancy versus her doctor's approach is we expanded on the limited set of thyroid hormones that they kept testing that kept showing up normal. We also look at other causes that could be affecting Nancy, things like liver, things like gut, cholesterol issues, blood sugar issues, hormonal issues, things like that. And then we provide mentoring and guidance because there usually are some changes lifestyle wise that need to be made, and that's what makes this a long-term success, because you can't out supplement a bad lifestyle or a lifestyle that needs improvement. You also can't do that with drugs either, and so we want to make sure that you have the right support, because we are experts in this field and we have a lot of experience with patients that have thyroid issues. One of the best ways we can help any patient is to do periodic retesting. That makes sure you're right on the right track. It also helps us, like I said, get out ahead of problems that could be coming up. Because sometimes if you think of your health like an onion, we're just peeling back the layers, and sometimes when you peel back a layer, you discover something else, and it leads to another success with a potential health problem that may or may not have been obvious to us. But that's why we feel we do make such a difference with patients' lives, not because we're so great, but because our approach is that proactive approach. So how did things end up for Nancy? Well, she had, after 2 months, her energy levels had doubled. Her knee pain went away. Mental clarity returned, so that meant no more anxiety or brain fog for her, and she was able to start exercising again. And here's what we found. The problem actually wasn't in her thyroid. The problem was in her gut. She was pre-diabetic. She had high cholesterol, which was the ultimate result of her thyroid malfunctioning. And so she didn't need thyroid medications. What she needed was nutritional therapy and lifestyle changes to help her feel like she wanted to feel. So by performing the right lab tests and reviewing those tests with her so she understood where the problems were and how it all linked together, we were able to explain to her that her immune system is really what was attacking her thyroid, and that was due ultimately to lifestyle choices. And so she wasn't managing her lifestyle correctly. in certain ways with not managing stress, not exercising, overeating, consuming too many carbohydrates, etc. And so by making the right lifestyle changes, by getting plenty of sunshine, exercising, changing the focus to more healthy foods, drinking plenty of water, getting good sleep, and also managing stress and finding time to relax, she was able to make the right lifestyle choices and changes that were ultimately able to help her gain control of her thyroid issues. So if you were wondering how important the thyroid is, this is just a short list of the things that the thyroid is connected to. And that's bone metabolism, your immune system, the brain and nervous system, your gastrointestinal or bowel function, your liver and your gallbladder, regulating growth and sex hormones, your ability to burn fat, regulating insulin and glucose metabolism, maintaining healthy cholesterol levels, and also maintaining proper stomach acid. Your thyroid works in tandem with your adrenal glands. So when you encounter stress, your adrenal glands release cortisol. That's a stress hormone. But stress itself doesn't cause a thyroid disorder. It's actually the impact that stress has on your body. And that can be to slow your metabolism. That can also lead to your body to cause T4 to not be converted to T3. Stress can also contribute to raising of blood sugar levels, which is a response to stress. Ultimately, this can lead to anxiety and depression, and that can be symptoms of hypothyroid. So it kind of works both ways. Sometimes a malfunctioning thyroid or an underfunctioning thyroid can be contributing to a problem, but there could be other issues, like we're talking about here with adrenal hormones, that could contribute to hypothyroidism. So again, that's why it's important to look at root cause and not just the symptoms. It's been said that if you fix the gut, 85% of the body's problems will go away. And so there's a system in your body called the enteric nervous system, and that's sort of like a second brain for your body. And the enteric nervous system is actually in the gut. So the gut regulates thousands of processes in the body. You might have heard of leaky gut before. You're certainly probably seeing things like IBS and different types of things advertised on TV and different treatments for this. But there's actually a good point to what all of this is about, and that's to improve your gut health. And in your gut, your intestinal system processes and breaks down the food you eat. It absorbs the vitamins and the nutrients and the minerals and all of those types of substances so our cells can get what they need. But when the intestinal cells become damaged, they can actually swell, and the spacing between them can allow toxins and other sorts of materials like bacteria and pathogens to be absorbed back into the bloodstream. So your body essentially can recycle its own toxins, which is not a good thing. And that's where the term leaky gut comes from. A lot of symptoms of leaky gut are going to be intolerances to foods. You can have food allergies. Your immune system, your white blood cell counts can be off or higher than normal. And again, it's usually going to be a subclinical thing, but it'll have a range that's optimal that could indicate that you have some issues going on in the gut. So one of the first things we always look at is what is going on in the gut, and that's most of the time what we end up addressing with patients. Even before we get to thyroid, we want to improve the quality of the gut. So if you're having trouble losing weight, or you're wondering why you're not able to lose weight, I came across this slide in doing some research for this presentation. I just thought it was kind of an interesting slide to see, but you can see the person on the left, the adrenal belly is just kind of like large, just kind of hanging out. The ovary belly, of course, is centered right around the ovaries. Thyroid issues tend to cause more of a pear shape in people. And then when we have issues with the liver, the rest of the body can look normal. And then you can see almost like if you were to tape a basketball to your belly, it's just like a round ball just sitting right there. And so this isn't completely 100% accurate, but it just gives you a good idea of where your body might be suffering hormonally just based on how your body stores excess fat and inflammation. We mentioned this briefly a few slides ago, but there is also a link between thyroid disease and diabetes. So the two terms that we see with thyroid conditions are hyper and hypo. Hyper meaning overactive, hypo meaning underactive. So this can lead to a problem with insulin, either producing too much or too little insulin, and that has an effect on thyroid hormone production. It also will affect blood sugar levels, and this is going to be affected by autoimmune diseases or autoimmune issues. And there's also something called the hypothalamic pituitary axis, or HPA axis. And this is how it's a glandular system in your body that regulates hormones and blood sugar. And this can all be affected by either having type 1 or type 2 diabetes, insulin resistance or metabolic syndrome, which are not necessarily diabetic conditions, but that's where you're on your way heading towards, most likely type 2 diabetes. But the link between thyroid disease and diabetes needs to be paid attention to because they do have an effect on each other. That's a very broad-based view of some of the most common conditions we see with thyroid and other related issues. But what we really want to get across in this presentation is that it is possible to transform your thyroid and your thyroid condition so you can get rid of that brain fog, so you can lose the weight that you want or feel like you have energy to exercise again. And just a quick review here, we use diagnostic testing to identify the causes of poor thyroid health. And then we're going to look at what's going on with your digestive health, what's going on with your nutrition, your hormones, the type of exercise you do or do not do, and also your brain health, because brain fog is very, very common when it comes to thyroid issues. What we will do is administer the correct supplements that unlock the healing, and we help you attain that long-term health with coaching and lifestyle changes. One of the most important things you can do for yourself is to make sure that your thyroid is functioning properly. It's important to remember that there are other potential underlying causes of a thyroid issue, and it may not be a problem with your thyroid directly. So there are multiple different ways that this can be managed, and there are some ways that we have to manage thyroid. Sometimes that means that there may have to be pharmaceutical intervention, but there are also natural approaches as well. So this can all be explored as part of our consultation process. If you would like to book a consultation to speak with us, please give us a call at 951-225-4419. And if your spouse or you have friends or family that may also be suffering from thyroid issues, we would love to talk to them as well. You can check us out on the web at www.growwithvitality.com. And we're also on social media, and our handle is @Vitality Integrative Wellness. So that's the end of our thyroid presentation today. Thank you for listening. We look forward to seeing you soon. Thank you.